Welcome back. This is another episode of the Chiro Hustle podcast. It's 6.5 years of these episodes, and this is 594. Today I have Tim Harrigan with me, and really excited. We're going to talk about demographics, global demographics in chiropractic. Healthy drugs. I know it's kind of an oxymoron statement, but functional medicine, functional nutrition, and blueprint medicine is what I call it. We're going to talk about some really cool stuff. Physical medicine. I know I said medicine a lot in this episode, but I think it's really cool that you come from a chiropractic background and you're helping people with functional medicine and functional rehab. Um, and his philosophy is to test, not guess. And before we jump into this episode today with Dr. Tim, I'm going to let you know our big why. Why do we do what we do over here at Chiro Hustle? Well, as fast as I can tell you, we protect freedom of speech with this show. We've never censored anybody. And I think that that's really valuable and important because not everywhere you go has the same tenets of what we do with the same truths of what we share. So chiropractic is one of those truths that we talk about consistently on the show. And family freedom and medical health freedom are so important, as you know, Dr. Tim. You being a practitioner wanting to affect the lives of 10 million people. Medical freedom is important for all those 10 million people because they had the chance to choose what they do for them and their families' bodies. And that's a domain that was really important for chiropractic because I believe without chiropractic standing in that lane and doing what chiropractors do, we'd be already squashed into medical tyranny. So chiropractic, I believe, is the last piece on the chessboard between check and mate of medical freedom and family health freedom. So if you don't see a chiropractor now, go find a family chiropractor and get under chiropractic care and make sure your nervous system's functioning at the highest level to where your immune system can function at its highest level. Philosophically speaking, we support BJ Palmer's last words. That's a sacred trust. If you don't know what that is, stop this episode. Even if you've heard BJ Palmer talk about the sacred trust or read it, go back and read it again. You're going to learn more, and it's good for you. We support subluxation centered based chiropractic. I know I shouldn't have to say that, but the schools are removing that from the schools. And I know I shouldn't have to tell people about innate intelligence and universal intelligence, but once again, the schools are removing that from the schools. So here we go. We believe that once man or woman, the physical gets adjusted, it connects them to man or woman, the spiritual. Dr. Tim, I see your head shaking a lot during that introduction. Thanks for being on episode 594 of the Chiro Hustle podcast.
My pleasure, man.
Yeah, it was really cool. We got a chance to warm the microphone up before we decided to hit the live button today. And I said, hey, man, what are a couple of things that you want to accomplish today? And you're like, no, what do we want to accomplish for you? And I was like, wow, that's really cool because usually everybody's really excited to share like what their agenda is. And then we got a little bit more granular and 10 million people. I like that number. I think that we constantly evolve and we resculpt. And your number one line of your bio that you sent to me was father, husband, doctor, influential speaker, purpose-driven, educator, freedom fighter. And I think a lot of that lines up with me doing this to that, lines up with your that statement that you have on your bio. So, doctor, let's talk about that topic first. What made you decide that you wanted to become a chiropractor and become a doctor?
Yeah, my story's a little different. If I remember from a lot of my classmates and, hanging out with chiropractors for, 4 years in college, I kind of fell into it, thank God. But I don't think we fall into anything. There was a lot of things that led to that falling into. I had been personal training for years, helping people get healthy with diet, exercise. That was kind of my college thing, and doing construction. I was an optician. I was going to be an eye doctor. That was ultimately the goal because my cousin, he was more like a big brother to me. I was going to essentially take over his practices. And, everybody wants to be called doctor, I think, at some point in their life. So that was really a shiny object for me to shoot for. So got my pre-med degree, essentially life sciences. And I'd been personal training the whole time. I absolutely loved helping people hands-on, affecting human physiology. So I think the new term for that is biohacking. I think exercise is biohacking. I think sleeping enough is biohacking. But what we've taken to a whole different level is kind of the newer trends of biohacking, with plant-based, extracts that are safe that, essentially I've helped people with the help of their medical doctor, of course, replace some of their medications with plant-based enzymes and things like that. It's like a safer, better option without as many side effects. So personal training led to me being an optician at the same time for about 5 years. And I was doing basically simple eye exams. I was, fitting glasses on people, doing the whole eye doctor thing. And it just didn't feel right. I mean, it's one of those things that I graduated, I was ready to apply for optometry school, and it just didn't feel right. My cousin, he felt that, and he's like, dude, you need to go talk to my brother-in-law. Kyle was his name. And so I had one discussion with this guy. An hour later, I literally switched my whole paradigm of thinking. I applied to chiropractic colleges the next week. He was doing functional nutrition. So I think at the time, I looked at it as taking my personal training degree to kind of a doctorate level, I guess, where I could do blood work. He was doing all kinds of really cool stuff and fixing people without drugs. So I think that was the shiny object for me. I said, that's exactly what I want to do. I couldn't really explain it before, but that's where my heart was. I always wanted to be a firefighter. So I think personal trainer got into that. I wanted to help people, save people, whatever you want to call it. And then this functional nutrition conversation just kind of led to me changing my whole, identity overnight.
So you something came up in me while you're talking about all these interests and how all culminated you being this. Vision. How do you determine functionally how to improve someone's vision? So you coming from the optometry world, I'm sure that this has been something that you had obviously walked down the path and they both led into each other.
Absolutely.
So when do you generally see vision starting to collapse for people, like eyesight? And how do you start correcting that? Because I'm sure a lot of people watching this would be like, okay, now I'm paying attention.
Right. So honestly, it's been such a long time since I was in that field. It all comes down to test, not guess. You go to a doctor, hopefully a good doctor, any type of doctor, dentist, whatever, and you get some sort of diagnostic. Maybe it's a mouth x-ray, maybe it's a spinal x-ray, maybe it's blood work, maybe it's cholesterol, which we all know is kind of a joke, but that's another test we can use. And it's just, you fix stuff that's functionally wrong. So I think I just got tired of looking at eyeballs and trying to help people with their eyeballs. I thought I was boring at some point. I'm like, well, I need more variety. I want to work with the whole person. But it's still diagnostic. So I mentioned to you that my wife was actually told she would never have children. So all we did was common sense stuff. I don't help people. This is kind of a funny joke. We've helped a few people conceive children that were told they would never have children, right? That's a common chiropractic story, I feel like. When you fix the nervous system and how the body handles stress and my innate intelligence, my organ, nerve flow, how everything's functioning, we bring the body back to homeostasis. It's a common story. And then everybody, every chiropractor has their own unique stories based on maybe their techniques or principles. But my wife was told she would never have children. All we did was we started her under chiropractic care. We started doing some kind of detox things to help get heavy metals and other toxins out of the body. We started eating a lower glycemic, whole food-based diet. We started doing some, fancy work with food-based enzymes and other nutritionals that were really powerful therapeutic food-based supplements. And 6 months later, we're pregnant. And it's kind of like, holy crap. I literally, my wife, we laugh about it now. I didn't talk to my wife for about 2 weeks after she gave me that news. We were in such shock. I was in such shock because, you get this thing in your head. You can't have kids. I was told I would never have children. I went through all these tests. I can't have kids. I can't have kids. That was our identity. And all of a sudden she's pregnant. I'm like, what in the world? How does that happen? So every person is different, right? Every person going through with that story, has unique deficiencies they need to work on, not enough of something, whether it's enzymes, minerals, water, real food, and everybody has toxicities. They're all different. You take 5 different people that can't have kids and they all have different heavy metals. They all have different, maybe synthetic vitamins they're taking in their body that shouldn't be there. It's actually more stressful on the body. And then they all have different imbalances, which we know chiropractic can help take care of those. So I like commonly telling our patients, think of an adjustment. There's much more to it. We'll get into that as we go. However, think of an adjustment as an adaptogen for your nervous system. That's what it is. I don't care if you're sympathetic, fight or flight, crazy, go, 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 anxious. It kind of helps settle that down. If you're low, depressed, not enough energy, we've all seen the stories where it kind of brings that back up. So that's why I like to use the word adaptogen, because as you know, with marketing too, we do have to market. I can't go, and just give people basic explanations anymore. We're so brainwashed from the mainstream. Some of these keywords like the biohack, like the adaptogen, I try to include some of that so that people start to understand some of this old school chiropractic stuff, but kind of with some new terminology they might be able to understand based on maybe only being 20 or 30 years old at the same time. So, it's diagnostic. I love diagnostics, whether it's EMG scans, right, that a lot of chiropractors use, or blood work, or more advanced toxicity testing. All we do is identify that stuff and start working on it. The safest, least invasive, most causative way possible is really our philosophy.
I think that this is a very valuable topic that we're on right now. And this gives another bullet point for you as purpose driven. I guess my curiosity around purpose driven and what you just talked about with this style of whole holistic care, understanding what the diagnostics are telling you. Why aren't more people doing this type of practice?
That's a great question, man. I kind of tease medical doctors a little bit. Of course, if we go to our medical doctors, they're good people. Unfortunately, they're in a system that's not a great system. That system is the third and fourth leading cause of death, for example. They're good people, but it's a system thing. And so it's I don't know, honestly. I've taken it to an obsession level because of myself. Again, I haven't been to a medical doctor in 25 years. My kids, 12 and under, from this lady that was told she would never have kids. They haven't even had a simple Tylenol in their body. So we live and breathe this. The hard part, as you know, is how do you bridge that gap with people to get them to understand everything they've ever learned, right? We're always fighting against the mainstream, the commercials, every fourth commercial is a pharmaceutical commercial. Everybody goes to their doctor and has their cholesterol measured every month. It's an ingrained every year. I'm sorry. It's an ingrained dogma that we accept as this mainstream. So I tease mainstream all day long with our patients just to kind of lighten up the fact that we're all brainwashed. We're all conditioned to believe certain things. My biggest pet peeve with a medical doctor yearly visit is we go in, I go for this physical, maybe, you get 20 or 30 blood measurements. That's the diagnostic. They listen to your heart rate, lungs, maybe a couple other things, but they take 20 or 30 blood measurements, which is absolutely, it's dangerous to do that, to be honest. Let me explain. There's thousands of things. If anybody's ever done lab work or, saliva, stool, blood testing, there's thousands of things we can measure. Let's just say there's 3,000. There's a lot more than that. But if I'm measuring 20 or 30 things out of those 3,000 things per year, what in the hell is that going to tell me about my body? Less than 0.001% of what's going on in my body, which is absolutely insane. But what we're doing is we're saying, John, everything's normal, looking good, you're healthy, come back next year. As John goes home and he doesn't exercise, he lets stress affect him. He's not under chiropractic care. He's not moving enough. He's stressed and not sleeping good enough. But I was told I was healthy because I have 20 or 30 labs out of 3,000 that are healthy. What a joke. But it's dangerous because that's a symptom-based mainstream, right? We're all brainwashed to think symptoms not there, you're healthy. Symptoms there, go get that treated with a drug. Well, it's insane to understand now two things, the things that people deal with. The number one killer is heart disease. You don't feel the arteries clogging. You have to do tests for that. You feel literally the heart attack. The first symptom of most heart disease is the heart attack. And half the time in that situation, when you have a heart attack, it's death, right? There's people being diagnosed with stage 3 and 4 cancer every day. They don't feel the cancer in their body. They're just waiting for stuff to show up. And then they get into this system where they're checking 30 things. And it's all symptomatic, basically. So I love diagnostics because you have to use them to look into the human body to get information.
Well, let me ask you this. You mentioned marketing earlier. Do you find now at this position in your career that you're hunting for more people to come in and see you, or has the trend changed to where now people are coming to find you?
Yeah, and that's where it's been for a while. And I've been delaying getting several. We've been needing associates for a long time. I've just been delaying it. What we do is very unique. It's customized based on my obsession and how I take care of myself and my family. So it's hard. We're going to do that in 2024 finally, but You know, you don't want to bring somebody in to mess up your baby, right? This is literally what we live and breathe. This isn't a game for us. This is my own healthcare model. So we're overdue for it. So yeah, we don't really do much marketing. Of course, we have a website, do some other stuff. I've been getting into videos and things like this, but yeah, we don't really market per se. We're not spending a bunch of money on SEO. So we're 95% referral based. Absolutely.
Gosh, it makes me think. There's people that are going to watch this and be like, I think I'm jacked up. And this is where you can be your educator now. I mean, this whole episode's been about education, but people are going to watch us and be like, well, I messed up. I'm going to reach out to this Dr. Tim guy. Because everybody innately knows that something's off. And they know that they've done their physical and they still don't feel healthy. They know that their energy levels suck. They know that their body isn't healthy because they look in the damn mirror. Like, you can fool your brain, but you can't fool your eyes. And that's back to your optometry. Like, we can fool ourselves into thinking that we're healthy, but we can't fool ourselves into looking healthy. And I think looking and feeling, they're very similar paths. How challenging is it for you to take a case on and one person and have them come to you, know nothing about what you do, plug into it, and start seeing differences? How challenging is it for you to take that person, and when do they start seeing some results?
Yeah, and that's part of our intake process, right? Because if you don't lead people, everything we do is we touch base with them. You know, I do a phone consult first. We figure out what's going on. And part of your question earlier was we do want to duplicate with associates and other things so we can help more people. That's really the next step, doing more of these to get this information out there. You know, we've been preaching what 10X Health is preaching now that's gotten very popular lately. We've been preaching that stuff for 20 years, you know, the Celtic sea salts, the coconut oils, all that stuff. So it's incredible to see that information on such a big stage. You know, every chiropractor on here, I don't care if you're a simple chiropractor, a straight chiropractor, you know, whatever technique you use, none of that matters. All of it's important because that's just how people are. There's a society out there that is confused. And so whatever your technique is, if they believe in it because of your education, that's the biggest thing. So we all have to fight against the mainstream dogma. You know, when they come in, I already know their objections. I already know what tests they've had. I can tell a patient, and this helps with patient compliance. You know, I might have somebody on the table that I'm working on and adjusting, and they might say, you know, I'm going to my primary. I went to my primary last week. He told me to go to a cardiologist. They found this, you know, murmur, whatever's going on with my test. And it's such a predictable system that I tell them exactly what they're going to go through. And that builds confidence in them because it's a system problem. It's not the doctor. Go to Tucson versus Mayo Clinic. It's going to be really similar advice, even though it's a different personality giving it to you. You know, they're going to probably do this test. They're probably going to run this other diagnostic. They're probably going to say this to you. They're probably going to use these scary words to say, you know, plaquing of arteries and potential heart attack and whatever. And then they're probably going to prescribe these 2 or 3 drugs. Let me know what happens, though. You know, you don't have to make any decisions over there. Just go get the test. I'm not against tests. So whatever diagnostics they do, I'm probably in favor for it. You know, the information's helpful. It's usually the treatments that are harmful because the 4th leading cause of death is medications, which is their main tool they use to help you. So once you understand that and you have conviction and you know the system and you're obsessed like me, and I read medical literature, you know, and I do my own blood work. I measure 200 to 300 things in my body every 2 to 3 months. So I'm testing all our supplements and all these things before they even become a recommendation. But I'm immediately fighting the mainstream dogma I know they're going to pull in. Even really smart people, as you know, are brainwashed, so to speak, to think a certain way because of the mainstream propaganda. We're trying to get more and more creative to figure out how do we break through that and get them educated down this path before they fall off to get them to point B and then point C eventually. So everybody responds differently. Part of our education with the results conversation might be the body takes time. First of all, healing is not overnight. If I give you a cortisone shot in your knee, you may feel better tomorrow or a week from now, right? You get a stem cell injection, you may feel better in this period of time. If I take morphine, 9 out of 10 of us have a certain outcome within 15 minutes. We feel a certain way. You don't feel anything, but you're a zombie. So we start with that. Then we go into healing. The body regenerates itself. 98% of your cells that are in our body, 10 trillion to 30 trillion cells, 98% of those weren't even there a year ago. That's incredible. But I just mentioned a year, not one shot in your knee and I'm doing better. You have to regenerate, but everything in your lifestyle is degenerative. You're on the medications, you're on synthetic vitamins, you're not under chiropractic care, you're not sleeping enough, right? So it's all about trying to figure out the rapport, first of all, because you're saying some wacky stuff to these people sometimes. Without the rapport, they're just going to walk out. I went to this crazy person's office and he started telling me that vaccines were bad or this or that. It's like, no, you can't do that. We all want to, and sometimes we need to, but you have to kind of get into their rapport and, you know, with the culture and what's the buzz on the street. You got to pay attention. And if you're obsessed with it like me, you just figure out a damn way to do it somehow.
Yeah. I couldn't even imagine if somebody came to me and they're like, hey, bro, I'm broken. Read my blueprint through my blood. Tell me what I'm lacking. Take a look at my poop. Take a look at my spit. And honestly, I think what you guys are doing is like the private investigator work of the body. When I think about, like, if somebody wants to find out what somebody's done, if they've done a crime, that's what we've done to our bodies. We're basically creating crime scenes of our bodies, and we don't know that we're the actual ones to blame for it. And
I love using that. That's an incredible analogy. Yeah, absolutely.
We don't know who actually is behind the mask on Scooby-Doo, but it's us. And our egos are too big to admit that we're doing dumb things and ill-advised things and feeding ourselves bad food and having poor habits and restructuring our bodies into a inflamed, sick state. And I think that having somebody like you that we can come to and say, hey, man, look into my trash bin. Like, check my spam folder, check my deleted files, check my blocked people, check it all, man. Like, look into like the good, the bad, and the ugly. Like, please. I think that that's what people need. And I don't think that I know anybody that's 100% healthy. Like, I don't. And I don't think I know people that have it all like figured out with the supplements that they take, the medications that they take or don't take, the self-medication through alcohol and cannabis and plant medicine. Like, I don't think that people have it all figured out. And a lot of it's guesswork that they're doing to themselves. And it's not making them emotionally stronger. It's not making them physically stronger. And now they have some weird systems inside of them, which is a virus, a parasite, a toxic level of heavy metals. And people do not know this stuff. And if they knew what it was or how to go attack it and to clean it up and to hire you as their PI for their health and say, hey, man, can you just look into my trash bins and my junk folders and help me out? Like, that would be a huge thing.
And I love it. And you nailed it. You just realized, I just realized we're forensics. We're doing forensics on people. And that's exactly it. So, but here, you know that there's also a problem too with insurance, right? Sometimes people are these really smart people, they want all this stuff we're talking. Every person wants this stuff, but who doesn't want this? This is common sense healthcare. We all want this. It makes sense.
It should be our birthright to have what you do.
Absolutely. And so some people, they see a price tag on a certain test or the hormone test we might do, and then we lose them. So that's why the education and the rapport and your conviction is so important to get them to that point. But whenever somebody goes through that process with us for several months, 6 to 12 months, maybe sometimes, they're always better. I'm not saying their condition's gone or, they're not diagnosed with something anymore, but they're always better. It's impossible not to get somebody better by improving their nervous system, fixing their toxicities, working on their deficiencies, changing their imbalances, because the body's too complex to do 1 or 2 or 10 tests and say, this is high, let's forcefully lower it. This is low, let's forcefully raise it up. That is ridiculous to me. There's 30,000 billion trillion chemical reactions per second in my body. That's in 1 second, not a day. That happens every second. 30,000 billion trillion, 30,000 billion trillion. So you have to simplify it, the deficiencies, toxicities, and imbalances. And chiropractic, of course, helps with all three, technically, if we're looking at nerves and innate intelligence, but really the imbalances.
So I'm thinking more on I know everybody's probably dealing with some type of inflammation. Mm-hmm. It's pretty rampant. And like if you went to knock on everybody's door in your neighborhood, like almost everybody that answers their door has some type of inflammatory condition.
Right.
Give me like one takeaway for people if they wanted to start working on their inflammatory conditions.
So, and that's a great question, because there are 2 or 3 foundational things we do in the office with people, right? One of the most important things, the most powerful thing, actually, honestly, the strongest thing I attribute to why my wife no longer has lactose intolerance, why we have 4 kids now, is a food enzyme deficiency. And this, I've heard Billy talk about this, lots of different people. It's common sense. The more live and real food you eat, the more alive and good you're going to feel, because life gives more life, right? We're eating all these ultra processed foods, not even processed foods anymore, ultra processed foods, but our thoughts cause inflammation. Our physical, position, sitting too long causes inflammation. Our diets cause inflammation. They all cause inflammation. But the one thing I've learned, this is my superpower with all clinical nutrition I do, is food-based enzymes. It all comes down to 3 categories of enzymes. Metabolic enzymes run my body. They're literally why we're speaking right now, why my heart's beating. Metabolic enzymes are the sparks, the catalyst as to why things occur. Far more important than any vitamin or mineral you've heard of. Not digestive enzymes. I have to make that clear to people, because everybody runs out and buys a digestive enzyme, which has animal pancreas or hydrochloric acid, these things that my body produces. Remember, I said food enzymes. They want to come from plants and nature. Those are essential, not something that my body produces, right? I even talk people out of taking melatonin, right? Any hormones. Your body produces all that stuff. What do you think is going to happen when you give it to your body? Your brain says, I have enough. Those organs shut down. They were weak to begin with. They get even weaker faster now because they're not being used. Good luck ever getting off that melatonin or whatever in a year, 5 years from now, right?
So how do you navigate all of this? And I know that you said right from the jump of our conversation today, biohacking. How do you incorporate fasting into people's metabolisms? How do you incorporate that type of process, or do you even consider that when you're going through this structure with a patient?
Yeah, James, real quick, let me just make sure I clarify, because I may have confused people. So there's 3 categories of enzymes: metabolic, then there's the digestive, that's the second category, and there's food enzymes. So when I supplement with the food enzymes, what I'm saying is it takes stress off the digestive and the metabolic enzymes. So that's why we need food. That's where a lot of my nutrients should come from. So food-based enzymes do not run on by digestive enzyme. We have people do that all the time. So I just want to clarify. So back to your question, I'm sorry.
Fasting,
Yeah.
because I know that a lot of times people can just like stop eating crap and drink a bunch of water and take some essential amino acids, and their body resets. And
Absolutely.
they can do that in 72 hours. And the next thing they know, their body's running on real fuel again. They
Mhm.
drop 10 pounds of inflammation, and they're 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 functioning again. So do you incorporate any type of fasting methods into your programs?
Absolutely. In fact, that gets us into the philosophy, the fact now, really, of we are, as Americans, we have terrible health. I forget where we rank currently, but somewhere in the 70s out of 80 industrialized countries. We have the worst infant, first day infant mortality rates in the world. It's insane. We are sicker than we've ever been. Our lifespan is getting worse. So part of our facts, what we teach people is we are overfed and undernourished as a nation. The McDonald's burgers, whatever, they don't have many vitamins, minerals, enzymes, these types of things. So there's a lot of calories in there. But this is where somebody can overeat also. If there's not enough nutrients in a meal, your body will literally crave more and more of those, nutrient depleted foods to try to get something, right? A double cheese, 2 double cheeseburgers, a huge French fry, a big gulp freaking soda. How does somebody eat all that? Because your body's starving for nutrients. So we have this really simple equation. Picture in front of you a math equation: H, which equals health, equals N over C, nutrients over calories. So H equals N over C. All that simply does is if I sit down and look at my meal next time I do it, let's say a donut, there's not very many nutrients in there. There's a lot of calories, right? So that might be 1/10, right? I'm just making up numbers here. H equals 1/10. That's not a good number. Now, if I have a whole bowl of spinach here, or, a grass-fed, grass-finished steak in front of me, there's a lot of stuff in there. There's actually a lot of nutrients, and really not that many calories. You got to eat a lot of steak to get overweight. It's impossible, right? So that equals health more than the donut does. So it's a simple equation to look at our food. We are undernourished and overfed with calories. So you have to figure out, how do we start flipping that ratio around? And that's why I use supplements, because this is a crazy study. I can share this with people, but a salad in 1940, this is essential. I don't care what chiropractic, techniques you use or whatever. This is essential because we're not getting nutrients anymore. We're literally getting void nutrients and just toxified inflammatory foods. So cutting out a meal, right? The intermittent fasting, great idea. We get too many calories anyway. It's not a bad idea for most Americans to cut out 1 or 2 meals in their day or snacks, right? So fasting, as we know, there's thousands of studies now showing how it's regenerative. You have stem cells that get excited. You have telomeres that lengthen. Our DNA literally improves from that. Our blood sugar starts getting more balanced. My blood sugar affects my neurotransmitters. My neurotransmitters affects my hormones. Insulin's a hormone, right? So when we start doing that, that's a critical thing for chiropractic to work better, right? It's a critical thing for my exercise to work better. It's a critical thing to start sleeping better because it affects my neurotransmitters and melatonin levels.
Well, the part that I think a lot of people are missing in all of this, in this conversation, is it makes your mood better.
Oh, absolutely.
And back to the old baseline analysis of why chiropractors became chiropractors is to help more people.
Yeah.
And I can't tell you how many times somebody will be like, yeah, I do it because I want to see people play with their kids again. Or that's a miracle story, right? Or that, they'll go down that path with me. And I'm like, yeah, it's great. Yeah, we want to help more people. But really, how do we create a system that improves people's moods, increases their glandular work, which I think too many people don't talk about. We don't talk about the glands. I can't tell you, I just went and did a marketing event yesterday for a chiropractor out here in Colorado. And out of the 16 people we worked with, they weren't chiropractic patients. None of these people were. 5 of them signed up to come in and see us. But out of that group of 16 people, dealing with thyroid conditions, lymph conditions, like cancer type conditions, to lymphs, and removal of glands like thyroid. Like we've structured that to be a normalcy, that people are just have burnt out thyroids and catastrophic glandular systems. Like, we have taken people to the scrap heap of their own health, and then we sell it to them as normal. And that's what they have to deal with. And one of my good buddies, Eric Plasker, would always tell me chiropractic first, chiropractic second, chiropractic third, chiropractic and drugs fourth, chiropractic and surgery fifth, chiropractic and whatever intervention you have, but always chiropractic.
Mm-hmm.
And these people were so resistant when I was like, look, go to your doctor. Cool. Get your test done. Cool. But go see us too. And while you're going to see us, continue to do what you're doing and see how long it takes you to not see them anymore. But chiropractic should be included in all of your decision making with each step of the way of your health from this day on forever. And sometimes people don't just understand like how simple it can be. But I always tell them, the reason you're coming to see us today, because most people don't know where to go or who to trust. You've got a chance to meet us today. Now we get a chance to help you. So thank you for letting us earn your business today. And I think that when we think about like what people don't really know and what they're actually told, we just need to clear up like the conversation. I think that a lot of the times when we talk about mainstream media, like agendas, or mainstream social media agendas, we forget to include into that the realization that people just don't know where to go or who to trust, and they're damn confused. So if we can become the solution for them, and we can become their advocates, and we can support them and help them, now we're going to have generational health like you're doing for your family. Now we can pass on good knowledge, and people should be investing in themselves. Like if you have designer shoes and a brand new car, you should figure out the investment to make yourself a brand new body. And you should figure out how to make yourself a new spleen. And you should figure out how to make yourself a new pancreas. And you should figure out how to improve your vascular system, because that's going to be the vehicle that takes you for a long time. And I think that our conversation today, it should land on people, and they should take it really seriously to heart. And they should, realize that there is a brain balance connection, but you have to have the right type of enzymes that are feeding your body to have the energy levels that you want, to where you don't get some type of crazy autoimmune disease that you don't know what it's called. You just feel like crap all the time, and that becomes your life.
Absolutely. And I think you and I both see a revolution happening where, the self-help gurus, the diets, the just self-improvement world has never been busier. People are catching on that this is my most valuable asset. I'd rather be homeless than sick, because if I'm healthy, I can rebuild it all. So people are catching on to that with these people that are getting on these big platforms like you, sharing this information. It resonates with people because it's absolute fact.
I had an Uber rider. I was going to the airport. I was speaking down in Atlanta this past weekend, but I got in the car with an Uber rider, and I said, if a man has his health, he has a million dreams. If he doesn't, he has one.
Yep.
And that seriously grounded that guy. And he was just like, wow, I never thought about life like that. And I go, that's why I come down here to inspire these chiropractors to be better at communicating what they do with people, so we can help more people. And I think that that's a big takeaway from today's conversation is I'm thankful for you having so much conviction as a father, a husband, a doctor, an influential speaker, purpose-driven educator, and freedom fighter. And BJ Palmer would always say it, I love you because you love what I love, and that's chiropractic. But I also love that you like to get to the root cause of why people have these inflammatory conditions that don't give them the lifestyle that they would really want, that they're proud of. So kudos to you for finding these pathways in people's lives and putting them on to a new way of living, which is subluxation free and based on real testing and real resolution, because I think that's where we're at. Is you are right. People are more inclined to biohack. And if they just knew that there were 3 original biohacks: sunshine, breathing, and chiropractic, all the other stuff is extra. Mm-hmm. So let's get back to the basics, but also let's find out what the analysis of what people's bodies are actually doing, so you can best help them. I know that we're almost on the edge of our time. I have to ask you 2 more questions. First one is, where's the profession going? I know that you're into the functional medicine space, the biohacking space, also a chiropractor, philosophically sound. Where do you see chiropractic going to in, say, 10 years?
Man, I honestly think if we all step up like this and people get louder and stop being so scared of, getting a board complaint, which I've had a few and we always win them because we're not doing anything wrong. The conviction is important. So people need to get brave, or we may not have chiropractic. It's going to be a version of it. We'll call it something. It's not going to be what we know of it, though. So it takes the Billies, a lot of these people that are just being loud and they don't care if they get in trouble. It takes those people. We need the straight chiropractors. We need the functional nutritious chiropractors, the neurological chiropractors. Everybody needs to be doing it, because if we don't try to help a lot of people with the culture, the way the marketing goes, with the way that people are thinking in the world, we will lose the profession, or it's going to change to something that, it's like changing definitions in history. In 20 years from now, chiropractic may have a different definition, kind of like they did to vaccines 3 years ago. Conveniently, they changed the definition of what a vaccine used to be. What every doctors learned about a vaccine definition in medical school, it's not the same anymore. They just decided to change a whole definition of something. So I think that's where it's headed if more and more people don't speak up about it. But again, I don't think it's going to go away. To be honest, my gut says it'll be here forever, because there are crazy people like you and me and the Billies and this and that don't give a crap what people think. I don't care if I get stones thrown at me, whatever, bring it on. Let's have a battle. It's that important. And so who cares? Go after it anyway.
And close this out with a miracle story. I know you've been talking about, you've seen some people coming in recently with lupus cases. Have you seen some major like lifestyle remolding and remodifications in some of your people lately?
Totally. I mean, this is a tough question, I think, for most chiropractors that are into what they do, let's say, because we get stories every day. I mean, to some degree. I mean, every time somebody comes in, we touch base with them. Hey, you were right. You did this thing to my neck and my ear, and my earache went away, or my nausea went away. We all get those stories every day, so it's almost hard to pick these. So I'm going to give credit to somebody else. Actually, my cousin, the functional nutritionist that I talked about earlier, that actually had an hour conversation with, that totally changed my paradigm. I saw this for the first time, which really piqued my interest. One of my cousins was born, and in the hospital, they had this huge lump on their neck. Now we would call it probably torticollis, something like that. But this baby's neck was stuck. They were in the hospital for weeks. There was this huge lump here. I think it was just the muscle that was spasming based on what I heard about it and what I saw. But they had to sneak this guy into the hospital to basically adjust the baby, right? The hospital wants all control, but here's what the hospital was going to do. If something didn't work, they were injecting it, unwillingly. They were doing all this stuff because they're under the hospital care. You kind of have to do what they want most of the time, or they'll call, somebody on you to get you in trouble. So they're doing all this stuff. Their next step was a surgery to basically cut through all those muscles so the baby's head was back to normal again. This huge lump here, just picture that. The baby's crying, uncomfortable, all this stuff. And so this gentleman went into the hospital, and the baby hadn't gone to the bathroom in it was like a week and a half or something. It still wasn't going to the bathroom at all. So this is a crazy story. It's like, and I didn't know anything about chiropractic at the time. So I was like, what in the world just happened? But this guy adjusted this baby's neck. It's not how most people picture an adjustment. Most chiropractors know he did some stuff to the spine and nervous system. We call it an adjustment. It's not the crazy manipulation, but anyway, it was just this subtle stuff that he did to this baby after weeks of just the doctors were getting ready to cut through it. The major surgery on this baby. He adjusted it. Baby crapped immediately on the table. This thing over the next 2 weeks just slowly kind of went away. And immediately there was like some movement in there when there wasn't. And then just over the next 2 to 3 weeks, this thing just kind of magically went away. I was like, what in the voodoo just happened? And when you understand chiropractic now, neurology and structure, muscles don't function independently of your brain and nervous system and spinal cord. No muscle does, no organ does. So the common sense approach to this 30,000 billion trillion per second chemical reaction, very complex system is a few key things. Get your nervous system functioning better. Stop eating the crap. Eat real food with nutrients in it. Move more. Sleep better. And be optimistic. There's studies that show being optimistic increases your DNA telomere length, right? So it's not hard, but when you do these very subtle foundational things, those 30,000 billion trillion chemical reactions somehow just get better. And you called it lymph, you called it glandular. That's all the stuff we call it, not realizing I'm not taking care of the structural, the foundational, things in my physiologically complex human body that's actually not that complicated.
Really powerful stuff today, Dr. Tim. If they want to reach out to you or connect with you, where should we send them to?
Probably email or our website. So maybe just Dr. Tim Harrigan at yahoo.com would be fine. DrTimHarrigan at yahoo.com. Because usually I'll send a video, a link to something, and then we can figure out the next steps. But yeah, reach out anytime.
Well, I think it's a really gracious opportunity for people to have access to you. And I think it's really powerful what you're doing for your community and the chiropractic community at large and the functional health arena. I think there's a lot of people that we rely on each other to become innovators. We rely on each other to become something greater. And then we come together and then we figure out how to make things better. And I think that that's what this conversation has done today. It's allowed me to see a snapshot of your passion and your integrity for what you do and why you do it and what the outcomes are. And I think it's really cool. So thank you for sharing with us on Chiro Hustle today. Dr. Tim Harrigan, episode 594. Check him out at drtimharrigan at yahoo.com. And he'll send you a video and you guys can figure out how to get your life back on track with his systems. So really appreciate you. I'll close out by telling everybody you're just one story away. Keep hustling. I'll see you guys on the next episode. Dr. Tim, have a good night, okay?
Thanks, man. You guys as well. Bye-bye.
All right, bye for now.